time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing that. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, just wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, that is called the truth. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got.
Good day and welcome to Kidney Hub East Africa, the show where we educate, encourage, and give hope to everyone, and I mean everyone, affected by kidney disease, especially in East Africa. I'm your host, Stevethekidneynurse, and today I'll be joined by my co-host as usual, Moses Kennedy, aka the Kidney Ambassador. Yeah, if you're watching from East Africa, you should get to know that name, the Kidney Ambassador. All right. Also, we have our special guest host, renal nurse specialist, Tabitha Matikwa. And today, we are truly honored to welcome a special guest, Millicent Njeri. Now, I hope I pronounced her name right. And if I didn't, please correct me, Millicent, when you come on. Millicent is a 13-year kidney transplant recipient. Her story is one of courage, resilience, and hope. And we can't wait for her to share her journey with us. So stay tuned with us as we talk about life after transplant, the challenges, the victories, and the powerful message her journey brings to the kidney community. This is Kidney Hub East Africa, where hope meets healing. Don't forget to subscribe, like, and share Kidney Hub East Africa so we can keep spreading kidney health awareness to more people. Now, before I begin, as always, where is it at? I got to show disclaimer. Now, before we begin, please note that Kidney Hub East Africa is for educational and awareness purposes only. Always, and I mean always, consult with your healthcare provider for medical advice, diagnosis, and treatment. Thank you for joining Kidney Hub East Africa. So with that being said, let me bring on my co-host and special co-host. First, we're going to bring on Brother Moses, and then we're going to bring on our special guest, renal nurse specialist, Tabitha Matikwa. So as always, we're going to give Brother Moses the co-host intro. Brother Moses, welcome.
Thank you so much, Brother Steve. I'm so glad this is yet another Sunday, and we are back live. This is Kidney Hub East Africa. I am super excited to introduce to you Millicent Njeri, our guest today.
Absolutely.
As we discuss this, kindly join, and you can ask questions on your comment. Welcome, everyone. Thank you so much.
Absolutely. So let's bring on our special guest host, her third appearance, and we definitely appreciate our special guest host, renal nurse specialist Tabitha Matikwa. Hi, Tabitha. How you doing?
I'm good. I had a good day. Thank you.
Yeah, welcome back. Welcome back. Thank you for coming on Kidney Hub East Africa. We always appreciate you coming on and sharing your wisdom and expertise with us.
Thank you so much. I'm glad to be on board.
Wait a minute. Let me move you over. There we go.
Mm-hmm.
All right, we got you in the middle. Now let's bring on our guest from Kenya, Millicent Njeri. We're going to welcome Millicent to have honored, wait a minute, let me repeat this. We are honored to have Millicent Njeri on Kidney Hub East Africa. So let's welcome to the show Millicent Njeri, and let's give her the VIP guest intro. A lot of you probably haven't seen this intro, but we're going to give it to her. Here we go. Hi, Millicent.
Hi, Steve.
How you doing?
I'm doing good. How are you?
I'm fine. I'm fine. What part of Kenya do you reside from?
Pardon?
What part of Kenya do you live?
I live in Nairobi.
Oh, you in Nairobi?
Yeah, I'm in Nairobi.
Oh, okay. Okay, welcome. How's the weather today? I see it's nighttime.
Yeah, it's nighttime. Weather is good.
Mm-hmm. Okay.
Yeah.
Okay. So, Millicent, we know you're a 13-year transplant recipient. Can you start by introducing yourself to our audience? Tell us a little bit about your life before kidney disease entered the picture.
Hello, everyone. Thanks for having me at Kidney Hub. My name is Millicent Njeri, post-transplant patient. I did my transplant in January 2013, but I got kidney disease in the year 2000, 1st June 2000. That is when I got my first diagnosis. Pardon me, I just had a tooth procedure. I'm in a little bit of pain, so I may be inaudible at times, but I hope we are going to get each other and understand each other. Before kidney disease, I was a little girl, so what I remember is just playing up and down. I was in primary school, and then my life changed all of a sudden. And since then, I've been on meds full time. Even I've been on steroids most of my life since the year 2000. That is 26 years ago. Yeah.
So, what caused your kidney disease?
It's called glomerular nephritis.
Mm-hmm. So, have you ever heard of that before it happened to you?
What?
Did you know about glomerulonephritis before it happened to you?
No. I didn't know anything about kidneys. I was in class 5.
You was where?
I was just 10 at that time. So
Oh, you was just 10.
Yeah.
Okay, so if you don't mind me asking, could you share your age?
I'm 36.
You say 46?
36. 36.
Oh, 36.
Yeah.
Okay. And so you've been dealing with kidney disease for most of your life.
Yeah.
So when did you actually start kidney dialysis before the transplant?
I started in August 2010.
You started dialysis in 2010, and then how soon after that did you get your kidney transplant?
After almost 2 years.
2 years. And was that from a relative?
Yeah, from my elder sister.
Okay. Thank you for sharing that. Now, let me ask you, Millicent, what would you like people to know about you beyond your medical journey? What would you want people to know about you if you didn't have kidney disease? Beyond the disease, your transplant, what would you like people to know about you?
I have not gotten your question.
Brother Moses, can you ask that question for me?
All right. Millicent, good evening once again. Good evening once again, Millicent.
Good evening, Moses.
Yes.
And you got asking your language, Brother Moses. So where's the better understanding? I just want to know what would she like people to know about herself beyond her medical journey?
Millicent, did you get that?
Yeah, I did.
Okay. All right. She's able to hear you clearly.
Okay.
Yeah.
Beyond my medical journey, I'm a mom. I'm a proud mom, hardworking. Yeah. I don't let it define me. I define who I am.
Okay. So let me ask you this, Millicent. How old were you when you started dialysis?
I was 20.
Mm-hmm.
Hmm,
Now,
Yeah.
how did you first find out that you had to go on dialysis?
Mm. I had just given birth to my firstborn, and around after like 8 months, that's when I started getting sick, and the doctor recommended dialysis when she was turning 9 months.
So when you said you was getting sick, can you describe some of the symptoms that you were having that made you seek medical care?
I lost a lot of weight, and I was vomiting most of the times, and being a young mother, and eating so much to provide breast milk for the baby, I could not handle it, and the vomiting was too much, and I was not urinating, and the blood pressure was always high.
Mm-hmm.
Mm.
So let me ask you, how was the diagnosis explained to you at that time when you had to start dialysis? Like you went to the doctors because you was experiencing these symptoms. How was that explained to you that you had to start dialysis? Did the doctors already know your case?
I think my husband and I found, I think he was on training at that time. He did not break the news so good to us. He told us that your kidneys are gone, just that, and referred us to the renal unit in Kenyatta. That is when I found Tabitha. That was my first time seeing Tabitha before she became the counselor, and she took us through the necessary procedures. She took us to the doctor who explained things well in details.
Mm-hmm.
Mm.
So let me ask you, Millicent, what do you understand about glomerulonephritis and how it affected your kidneys? What do you understand about it? Did they tell you about this disease, glomerulonephritis, and how it affected your kidneys? Was that explained to you?
No, no, not really. Because my file was retrieved from the 2000 records, they just continued from where they had stopped.
Can you repeat that? I'm sorry.
Not much of explanation was made. As much as I can remember, I was just told I have to start dialysis to get rid of the fluids and the urea, and bring down the creatinine levels.
Mm-hmm.
Yeah.
So, how did learning about the cause of your kidney failure affect you emotionally?
Well, um, it affected me so much, and it's draining. Even now, it's still draining emotionally. One is very unstable.
Mm-hmm.
Yeah.
Okay. So, what was the hardest part of living with kidney disease before your transplant? What was the hardest part living with this disease before you got your kidney?
The worry of dying when on dialysis, that was just the worry before transplant. because those 4 hours are so long. You find maybe you started dialysis with your colleague on this bed, you're on this bed, and they have sadly passed on. And now you start asking yourself if I'm the next one. You wait for those 4 hours to end. They are not ending. Then the machine beeps, your blood clots, fear of the unknown, so many things went on that machine. You don't know. You just don't know if you make it out or you just, die when on the machine. It's just prayers that work. And you tell God to maintain you for those 4 hours until you finish your session, until now the next session.
Mm-hmm. Was it emotionally hard for you?
Yeah. It was very, very hard. Now, you see, I was on dialysis and I had a young family. All I could think about was, we got separated with my daughter, not because I was sick. My mom took her. She was living with her. She brought her up. So it was just my husband and I. He had to start to juggle between the hospital and jobs, you see. So my greatest story was dying, and my daughter will never know about me because she was just 9 months or 10 months. I didn't want her to grow hearing stories about me.
Mm.
Yeah.
Okay. Brother Moses,
Yes, Brother
um,
Steve.
you know, you can take over. I know you have many questions and that you want to ask our guests, so you go ahead and take it from here.
Oh, yes. My sister Millicent,
Yes.
your story really caps it all. Um, I've been on dialysis for now close to 10 years. It's 9 years and a half. Allow me just to ask you a few questions in relationship to some of the points you've spoken about. Can you walk us through the journey that led your kidney transplant?
I started the transplant journey in early 2011. After some months, after doing tests with my sister, our second born sister, Evelyn, they found out that I had TB. So I had to take meds for 8 months, and um, I was given 2 months to be free. Then I do the TB test, then go back to the transplant list. After that is now a year. In 2012, no, in 2012, they said that my heart was big. I could not do a transplant, and we had even been admitted and given a day. Now that was postponed. So I think it was even at that time there was very poor dialysis because there were no much dialysis centers like there is today, and we were paying cash during that time. The only center was in Kenyatta and Nairobi Women Hospital, which was private, the ones that we could afford at that time. Of course, the big hospitals had dialysis centers. Because of poor dialysis, that is why my body started being weak. My heart became big, which was treated in Aga Khan for over 6 months. And in December, we just decided to go to India for a transplant. And that is where my journey started, my transplant journey started.
Okay. So how long did you wait before that the transplant? I mean, how long from
Yeah.
maybe all this event to transplant? How long did you wait?
From August 2010 to January 2013. That is 2 years and like 8 months.
Okay. Okay.
Mm.
Now, who supported you most during that period?
My husband, my family, his family, and friends supported us.
Awesome.
Mm.
Now, maybe let me add another one. What do you remember most about the day of transplant?
What I remember the most,
Yes,
uh, it's me
about the day
waking.
of transplant.
It's me waking up and passing urine. Like 2 years plus, I've not passed any urine, and then you wake up. Yes, you're in pain, but yeah, the urine bag is full, and you are hearing the doctors say that it was 100% successful.
Wow, it must have been perhaps the most liberating news and maybe experience to go through. That is the same wish I also looking forward. And what was going on through your mind before and after the?
I just hope I was just hoping for a better life, for a future, uh, to be able to take care of my family. Just that, and not to
All
live
right, that's
in any
awesome.
worry. Mm.
Okay, now maybe the last one before maybe we get back to Steve. What were the biggest challenges after your transplant?
The high cost of medication.
Mhm.
During that time, there was an HIFUS, and it was just supporting civil servants. So those who are not civil servants used to buy the meds in cash, and they were very, very expensive. That is why I understand that so many people, we were a lot of over 200. So many people have sadly passed away because of rejection, because they could not afford the medication. Some are on dialysis. Yeah, our lot has really suffered before shacking and started giving meds for free.
Okay. So before, during the time of National Hospital Insurance Fund, the drugs were quite far way beyond uh, accessible, right?
Yeah, yeah, they were very expensive.
Okay. Okay.
Mm.
All right. And did you experience any side effect, fears, or complications?
The side effects of the meds is it's just general body weakness, which is ever
Mhm.
there, because you know there are so many types of medication you are taking. Also, sometimes I live in constant fear. Maybe I may just wake up one day and I find myself swollen. I go to the hospital and then the doctor says, I am sorry, we have to start you on dialysis. That the fear of going back to where I've come from is what eats me a lot, and
Okay.
it is traumatizing.
All right. Because and you frequently need anti-rejectory drugs. Just share with me because those are also one of my fears. Uh, if I have to do transplant today, how accessible are these anti-rejectory drugs? Because I've had other complaining from Mombasa, others in Northeastern are unable to get these drugs, and few in Kisumu here. How accessible are you managing about these drugs?
It all depends with your financial status when it comes to the medicine,
Okay.
and maybe the support that you'll get from your family. You know, the problem comes when you're on dialysis, people know that you are sick. When you do a
Yes.
transplant, people believe that you are now healed, which it is not. what you have done is you've left dialysis. That is step one. You've gone now to a more expensive step, which will be you'll be taking meds full time throughout your life or until the kidney rejects.
Oh yeah, it's the same as when you fall sick the first time. There are so many in support of you, like your support system is so big. And then as you go on dialysis, year in closes, then you realize you are alone in this journey, right? Do you mean something like that?
Yeah, something like that. When you get
all
sick,
right.
when you start dialysis, let me be open.
Yes. Yes.
The first sessions, people come.
Yeah.
You can even be
In
getting
numbers.
like 20, 30 visitors in a day. When you continue, like
Yeah,
after 6 months, after 1 year, it is just
they
you
have
and your
dropped.
family. Then after some time,
Yes.
even your family wanakuondokea a little bit, even yourself, it's just you and your spouse, or you have big children, yeah, or your caregiver. Then when you do the transplant, now people again come to visit you, they congratulate you. But as months go by, now they think now you are totally healed, you don't need money, and that is now when you need money the most, because you are buying medicine, you are doing tests, there is doctors consultations, and sometimes you might go to the hospital and the doctor is going to tell you, this test did not come out the way I wanted it to, can you do a repeat? And maybe that test is going for like 5,000 to 10,000, you see. Now you start making phone calls. Oh, so help me with 10,000 I need. Now they start saying, as you are healed, how comes you need more money? You see? Now that is where people now are supposed to be made to understand that when someone does a transplant, that is when they need money the most.
The most. Because it is also something so critical. Like if you miss the money and to buy drugs, it means you go back to square one, back to dialysis again.
Yeah, and now when you go back to dialysis, you might find someone saying, you see, she did not take medicine the way it was supposed to be. That is why she went back to dialysis. And you've been calling them, help me with money to buy meds. So the system is bad.
Mhm.
Yeah.
Well, how did you adjust to life on medication and regular checkups now?
Number one, I hate taking medicine. I hate them. But now the fact that I have to live my life depends on the medicines, and I have a young family. I don't want to disappoint everyone who has supported me, because if they hear that maybe I've died because I refused to take medicine, they'll start saying, after all the effort we have made, I had to adjust myself psychologically and tell myself that, Millicent, this is your new life from now. Don't disappoint your sister who gave you her kidney. Don't disappoint those who use their funds to make you stand and be where you are. You have a young family to take care of. So it is not easy to adjust, kwanza psychologically, knowing that your whole life is going to depend on chemicals, medicines.
All right. Thank you so much. Back to you, Brother Steve. Your mic is mute.
Thank you for that, Millicent. Is Nurse Tabitha?
Yes.
Welcome back. Welcome back. Thank you.
Thank you.
I know you had some questions for Miss Millicent, as you mentioned that you are very familiar with Miss Millicent and her transplant journey. So I'll let you take it from here with your questions.
Thank you. Thank you so much, Steve, Moses, and Millicent. And maybe what I would really like to ask Millicent, tell us about family support. Now, from that time that you were very young, what family meant to you up to now, and the people maybe who have been supporting you along the journey. Thank you.
Hi, Tabitha. I'm fine.
Hi. Thank you.
About family. Oh, my family has supported me a lot, and my husband here has supported me a lot, and his family too. Everyone has been great so far, so good. And having a young family and being sick, it is not easy. But my my mom made it look so simple and easy. That is why I think I was also able to overcome it.
Well, thank you so much. And I want to say sorry. I know recently you lost your mom, and I know she really meant so much to you. And I hope you are doing well past that loss. Maybe you can share something about your mom if you feel it is okay.
I I uh, I I don't want to share. She
It is all right. It is all right. Um, 13 years post kidney transplant, Millicent. You've really done very, very well. Maybe what I would really like to ask you is how your life has changed since you did the transplant, moving from dialysis to transplantation. How has your life changed?
Well,
Yeah.
the only change there is just that you are from the machine, now you've moved to meds, and yes, there is constant worry of dying, but it is not so much like before.
Yeah.
Mm.
Oh, thank you very much. And then, if I would ask, what has staying healthy after kidney transplant required of you? What does it mean now to stay healthy after kidney transplant?
Abu, repeat your question.
I'm asking, what has
Mm.
staying healthy after kidney transplant required from you?
Taking your meds on time,
Mm-hmm.
taking enough fluids, the recommended
Mm-hmm.
fluids by the doctor, eating
Yeah.
healthy, and avoiding a lot of stress.
Yeah.
Mm.
Thank you very much for that. And what routine have helped you maintain your kidney health? What are part of the routines? Do you
Mm.
have to like set the alarm?
Yeah, I have alarms for AM and PM. I take my meds at 10 a.m. and 10 p.m.
Mm-hmm.
If maybe I'm late, it's by like 10 minutes or so, but I've never missed to take to swallow meds even on a single day. I thank God for that.
Wow.
I've never lacked.
Hey, congratulations even for that. And how important has, let's say, for example, medication mean to you?
Yeah, they are very important because they are sustaining my kidney and my life, and they are prolonging my life despite the many side effects, I look at the positive side that is pushing me forward and giving me a better tomorrow.
Wow, thank you. Well, what about the diet?
I eat anything.
Oh,
It is sometimes it is so hard to follow the diet. By the way, if I pass by and see nyama choma, I'll just eat.
maybe you
Yeah.
can tell us, so, like post kidney transplant, do you take alcohol? Very personal, but I think it is important to know.
No, no one is not supposed to take alcohol.
Yeah, and I think as I'm asking this, it's good for us to pass it like a healthy message because of drug interaction. We say no to alcohol post kidney transplant. I know there are so many patients who struggle with that, but we say a no. Just to
You
ask you,
see,
Millicent.
Tabitha, you see,
Uh-huh.
when it comes to the alcohol issue,
Yes,
so many youngsters are being transplanted. You find someone who is just 18, 17. They've just
yeah.
gotten a
Welcome.
transplant and they are joining the university. They've not
You
Mm-hmm.
can come
tasted
to
life. So
Steve
when
the Kidney
they go
Nurse
to the
Facebook
university
page or
and
YouTube channel
interact with
to
people,
watch the show.
Mhm. and they
Sorry.
interact with others who are having alcohol, you see now they start taking and start enjoying.
Yes,
And deep
but now,
down they know they are not
mhm,
supposed to, but on the other hand they want to fit in.
yeah.
Mm.
So we are letting them know post kidney transplant, it's a no because of drug interaction, especially now we are talking about the recipient. And as you can hear, also Millicent doesn't take, and she has a good message there. Millicent, maybe just to ask you, you can tell us about the follow-up, post kidney transplant follow-up, and the costs and the investigation, and maybe how much is the cost of follow-up on your side.
For the follow-up, for let's say when you transplant for the first 1 year, no, for the first 6 months after transplant, I think it is weekly. And then after
Mhm.
that, it goes to after 2 weeks, then after 1 month, after 3 months. For me now, I'm supposed to go thrice in a year, but I have to do tests every month. And it depends on where one is planning on doing the test. There are so many labs, but I usually spend about on the required test. I usually spend around 7 to 13,000 in a month for the test only. Doctor's
Mhm.
consultations, you can. I go to Kenyatta National Hospital and I also see Dr. Mbogwa. So those are two consultations. For Dr. Mbogwa, it's 3,000. For Kenyatta, it is 1,700. So every month you have to budget for, let me say, for like 15,000 tests and consultations, and then you add for the medicine. My dose as per now, it is at 8,700 because on a very low dose. Yeah, as years go by, your body starts, I think, adjusting to the medicine or something. The function becomes so well, and I'm really glad that my creatinine levels have never misbehaved. It's just that now, due to the grief, uh, just now from February to now, they are a little bit high, but all those years they have been good. And I had forgotten to mention that this kidney has given me a boy. He's now 10.
Wow, congratulations. Maybe maybe to you can share with us your pregnancy journey post kidney transplant. what it really meant for you, and maybe how it was. Did you need to see a nephrologist? Did you need to see also a gynae? How did they work together? And all the tests maybe that you had to do. You can share with us the journey.
Number one, when you are a kidney transplant patient, that journey is very expensive. You have first to be prepared financially, because now you see you've added a gynecologist, and now you'll be required to be having 2 clinics each month. Then as time goes by, you'll be having clinic after every 2 weeks. Now when the due date is near, every week you must have a clinic. During pregnancy, the dose really goes down so that it does not affect the baby's growth. And also you have you have to take all those supplements to help you and your baby. You have to be eating well to also to avoid getting diabetes in the process, and your pressure has to stay low. So it is awesome, but it is very expensive. If you are not ready for it, don't do it, because after like some months they'll have to terminate your pregnancy. And also it is not good psychologically and emotionally. You prepared yourself, you're going to have a baby, and then you're told that your pressures are misbehaving, maybe diabetes is coming in, maybe you are going to face a rejection. So all that must go hand in hand. The gyna and the nephro, they must work together for your pregnancy to be successful. I enjoyed mine.
Thank you. Thank you so much, Millicent. And maybe just to add on that, for a lady who has just been transplanted and maybe you are considering getting pregnant, it's good to get an okay from your nephrology team, who is supposed to send you also to the gynae to evaluate you on possibility maybe of you getting pregnant. Again, when you get pregnant, post kidney transplant, remember you have to maintain the 2 clinic, the nephrology clinic and the gynae clinic. And our babies are born through cesarean section. Kindly do not subject our kidney to normal delivery, because the trauma of pushing and going through the labor can affect the kidney. It can cause a rejection. So we normally advise the baby to be born through the cesarean section. After that, you're supposed to be followed again by the gynae post-delivery and the nephrology, and then later they release you back to the nephrology team, which is very important. Now, Millicent, you can tell us, what advice would you give to someone struggling to stay consistent, maybe with their medication? Someone who has been transplanted and is struggling to remain consistent with their medication.
There is something that we call denial. For me, in my first months of dialysis, I was in denial that I'm not supposed to be on this machine. Why? Why me? Why should I? Then after transplant, another denial. Why should I be having medicine when so and so is living a good life? I think also, Tabitha, when you are doing the counseling sessions with Nancy, uh, include that. Yes, we want to have a transplant, but so many people are in denial, and they think that it is very easy to be taking medicine daily. It is not. It is not easy. And counting like 8 to 10 tablets at once, swallowing all those tabs at once, and maybe you are comparing yourself to another person, that one can also bring about depression. You find yourself depressed, asking yourself so many questions. Why me? Why should I be living like this? And I've lived a good life, so and so is living so carelessly, and their life is so perfect. Why should I be doing all this?
Right.
Thank you so much. So
All
it
right.
means maybe someone who is struggling, some of them may be suffering through the stages, like this, we say like the stages of grief, where there's denial, there's anger, there's even depression, before maybe sometimes someone can even reach acceptance. And we are saying post-kidney transplant medication is very, very important, and we say it's always good to make sure you take them on time. So Millicent, what message would you like to give to someone who has just been diagnosed with chronic kidney disease? Maybe they just need dialysis, or maybe they just need to do a transplant. What message would you like to give to them?
I will tell them that it is not an easy journey that they have started. It is an uphill task. And if you if your kidneys start functioning within the 6 months which are given, then you are good to go. But if they are not, you start thinking of having a transplant instead of wasting a lot of time on dialysis. Yes, the machines are now available everywhere. There are so many centers in each and every county. Um, the government, Uhuru's government, made sure that he has enabled each and every kidney patient to get affordable and accessed dialysis locally. Um, it is not a death sentence, but there are people who believe that I will not say the tribe, but they believe that they have been bewitched. It is not witchcraft. It is your body. It is your life. So if you've been diagnosed, what? Okay. If you have a diagnosis of a kidney disease, you follow what the doctor has told you. You start dialysis. You will not die, and be positive about it. Even if your life is going to change, you have to be positive, accept, and yeah, do your thing. Your life will change.
Thank you.
Yes, you'll not do what you are doing before, but as time goes by, you are going to adapt and adjust yourself.
Oh, wow, that is very nice. And do you have any words of hope you would like maybe to offer other warriors? Words of
Yeah,
hope.
we move we swallow medicine and move on. Life is moving very fast. We move with it, and we are not dying from kidney failure. We are not going to go back to dialysis until we are told that the kidney has 25 years after being
Mhm.
transplanted. Those are so many
Mhm.
years. You have built yourself very, very well. And yeah, we swallow medicines and move on.
Wow. I think I'm really happy with you, Millicent. You've really done well. I've seen you go through it. I've seen you on dialysis. I've seen you post kidney transplant, and I would say that I've even seen you come for follow up, and it has just been a very great journey. And I also love the way you've come up to even share your story and even to encourage other people, which is very, very, very good. Maybe to ask the final question, looking back, what do you wish you had known at the start of your transplant journey? What do you wish you would have known earlier at the start of your transplant journey?
Uh, what do I wish I had known earlier? Hey, that one is a tricky question.
Mhm,
Yeah, we had been prepared that one takes meds forever to sustain the kidney.
mhm,
And I wish I wish the expenses are too much. Even that we knew we had been prepared also. Also, that is what is making people also not want to go for transplants, because you see dialysis is fully catered for. And now, yes, SHA is providing medicine, but most of the time is when we don't get. I think we meet on the corridors most of the times, and you ask me if I've gotten the medicine, nakwambia nimepata like 2 weeks or so, like that. Yeah, the cost, just the cost. The cost of living is so high, and now you add for a kidney patient, you add the medicine and the tests, and the doctor's consultation is also still going up in Kenyatta. It started from 500, went to 700, now it is 1650. Now you see, all that included, and one has a family, one is choosing to stay on dialysis rather than having a transplant.
Wow. I would say you've really done well. You've really done well, even in your transplant, and even being a mother, being a wife, being a sister. You've really done well, and I think even as one of the nurses who've really taken care of you, or even the counselor, I would say well done. I would like to hand over back to Steve. Yeah, thank you. You're mute.
Yes. Thank you, Tabitha. Well done. Well done with that. Some great questions and some great answers from Millicent. And that pretty much brings us to the end of our show, Kidney Hub East Africa. But I want to say, Millicent, my condolences to you. Excuse me, I didn't know that you recently lost your mom. I can share with you that I recently lost, hold on. I recently lost my mom as well. In July it would be 1 year. And she was 95, and it happened really quick. So I just want to send my heartfelt condolence to you. So as I said, this brings us to the end of today's show, Kidney Hub East Africa. A heartfelt thank you to our special guest, Millicent Njeri, for sharing such a powerful and inspiring story as a 13-year kidney transplant recipient. Your journey reminds us that even in the darkest season, hope is never lost. Thank you to my co-host, Moses Kennedy, aka the Kidney Ambassador. Always good to have you here. And our special guest host, renal nurse specialist, Tabitha Matigwa, for joining us today. With that being said, to all our viewers and listeners, we appreciate you for staying with us. May this conversation leave you encouraged, informed, and reminded that every kidney story matters. I'm Steve, the Kidney Nurse, and this has been Kidney Hub East Africa. Where hope meets healing. Until next time, stay strong, stay hopeful, and take care. Brother Moses, thank you for joining. Tabitha, thank you. And to our special guest, Millicent Njeri, thank you for joining the show. And we'll see everyone next week. Thank you, everyone, for joining, and have a great evening. Good night.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.